Hi, Paul here, and I'm here at the European Association of Endoscopic Surgeons with Philip Gunn from Victoria, South Australia. And Philip, congratulations, by the way, on your article being published in JSLS using the silicone suction device for retraction. And it sounds like it has great potential. It's very soft, very gentle, and I was wondering if you could, for the folks that couldn't be here, if you could tell us a little bit about it.
The retractor was originally developed as a liver retractor. It's a very soft silicone ring attached to suction tubing, and the tubing comes out alongside existing laparoscopic ports, so you don't need an extra incision. Although it was conceived as a liver retractor and it works very well in that regard, it's been used in splenectomy, and this was my publication was based on 2 case studies that we did for splenectomy. And the great thing about it was that the Livac kept the spleen suspended up against the chest wall. It was very, very stable. All of the procedures were only 3 incisions. In fact, 2 of them were 2 ports and a needlescopic. I've actually done 3 of these so far. Yeah. And it meant that the only assistance I required was someone to hold the camera. The spleen stayed up on the wall. It did not move. It gave fantastic exposure of the hilum and enabled me to do a very selective dissection of the splenic vessels. So it was great to get that published in JSLS, and also to have the opportunity to present the video which matches the document up in MIS Week coming up.
Right, and so
September.
We're looking forward that at
Very
MIS
much.
Week to see that. And I know a lot of people would be interested, especially with cross-pollination from different specialties, about a soft, gentle retractor that can hold tissue out of the way.
Not currently registered medical device in the US, but we are submitting our 510K, and also that it's currently, it was used off-label for splenectomy, in that we didn't conceive of it as a splenic retractor. We conceived it as a liver insulation.
And that's the first time we saw it was when you showed some videos of it retracting the liver very well.
Yes,
yeah.
yes. All the current liver retractors retract from underneath, so they push up from below, and probably the most commonly used retractor in Australia certainly, and I think in the US, is the Nathanson retractor.
Right.
And it's a very strong retractor. It's steel, it's bolted to the operating table, so you can't get stronger than that. However, one of the issues with it is the potential for liver congestion, because it's pushing up and it's a rod. It acts like a tourniquet, and you get this venous congestion, and in prolonged operations, and in particular with the fatty livers, you can get venous congestion or even infarction. And there are good case studies. In fact, in my literature review, I saw a study showing that about 18% of Roux-en-Y gastric bypass patients had liver damage shown on CT.
Right.
So that's a pretty significant figure, and so I think this will be a gentler form of retraction.
Well, great. Thanks, Phil, and thanks. I hope you enjoy the rest of the meeting here in Amsterdam.
Thank you.
It's a great meeting, a lot of interesting things happening, and great talking.